Hi, I'm Dr. Som, a board-certified plastic and reconstructive surgeon. Today we're going to talk about facelifts. So facelifts are exactly what they sound like. That's where we actually want to help rejuvenate the face by creating a lift, removing a lot of that excess and redundant tissue, and really relifting a lot of the tissues that gravity's pulled down with time. So most commonly, one of the target areas for us is the malar fat pad, or really what makes our cheeks look that nice youthful lift. Common different approaches to the incision we're going to review in a sec, but typically coming in front of the ear and then extending up behind into the hairline. We try to hide that incision as best we can where it's almost imperceptible in most people. And then we come in, lift everything up, find that descended tissue resuspended with some sutures to hold and lift it back up, and then remove a little bit of that excess tissue, thereby creating a more youthful look, tighter face and jawline, as well as lifting up our malar fat pad or cheek, giving that nice lifted look. So when we look at our typical face, with our hairline up there, we have our ears. We'll make the incision right along the line here and then go up behind the ear and down at an angle. We will typically lift up and dissect this entire area and find that malar fat pad and resuspend it with the suture. Our angle is somewhere between 30 and 45 degrees where we do our lift to pull everything back. We don't want to go straight back. It looks like you've been windswept or you've had your head out the window of the car, but a more natural look is somewhere between 30 and 50 degrees in most people to get a more natural appearance. The other key is not to pull too tight so someone looks like they've been stretched, but a more natural look. In doing so, we'll come in and lift this all up, free up a lot of the tissue. Typically, we'll leave a drain when we do a lot of work in the neck. That's typically done through a separate incision about 1 to 2 centimeters underneath, where we'll combine with some liposuction that really covers the entire area of the neck and jawline in particular to give that nice, clean jawline look and a platysmoplasty or tightening of the neck muscle to really help get that nice lifted neck at the same time with the face. Patients do well. We typically see them 1 or 2 days afterwards to remove that drain. It doesn't stay very long at all. And then you wear a head wrap for about 1 week. Afterwards, being able to do a little bit more activity. Sutures are non-dissolving sutures because they scar less. Those typically come out between 5 and 7 days as well. Again, facelift, patients love them. It takes about 10 to 15 years off anyone and lasts for about 10 years in our experience using the technique that we use. I'm Dr. Som. If your loved one is interested, feel free to contact us or come on in. We're here for you.